Hi, my name's Mel Meyer. I'm an emergency medical physician here at SageWest in Lander. I'm also the chief of staff here at the hospital, and I'm here with Dr. Paul Ebbert, who is the CMO or Chief Medical Officer at Wind River Family and Community Health. I want to say, just to touch bases with everybody in the community, that if you have a medical problem, a medical emergency, please don't stay at home. Please make sure you go in and get checked out, whether that be at the emergency department that is closest to you or your clinic or your family doctor. Make sure that you get checked out for anything that you seem worried about or you think is an emergency. We're still seeing all of the basic medical care that we do normally around the year. So again, please don't stay at home if you're having issues. We are at the hospital increasing the number of beds that we are taking on. We've increased here at Lander, we've increased the number of ICU and med-surg beds to take care of the COVID positive patients. And it just, not intentionally, just morphed into Lander being the COVID positive patient group and Riverton being those that are not suspicious or COVID negative. Women's Health is still active and separated from the COVID positive unit. So all Women's Health people, pregnant ladies, please still come to the Lander Hospital. At this point, I'll turn it over to Dr. Ebbert, again, who is the true heroes. He's the hospitalist that have been taking care of all of these sick people, and they have been doing a marvelous job.
Like Mel said, I'm Dr. Paul Ebbert. I'm the Chief Medical Officer at Wind River Family and Community Health Center in Arapahoe. I know by now that all of you have heard a lot about coronavirus and COVID-19 and all the things that you're supposed to do to protect yourself and your family from this illness. We're worried, however, that some of you are not paying attention to your other medical problems. We don't want people to be so afraid of the COVID-19 virus that they are not getting care for their regular medical problems or for serious medical problems that could result in harm or death. The hospital and all the clinics in town are taking precautions to try to protect people from the coronavirus and try to protect both patients and staff from spreading it. So please, if you have a medical illness that you are having trouble with, please call your doctor and your clinic and they will tell you what to do. If you have a medical emergency, whether it's an illness or an injury, please go to the emergency room at the hospital. And as I said, they will be taking precautions to protect you and to protect themselves from the coronavirus. We want to make sure that nobody is suffering harm because they're so afraid that they don't seek care when they should. Remember to do all your regular precautions. The real heroes are those of you who are staying at home as recommended and doing all the things that you should do, like washing your hands frequently, covering your coughs, social distancing where you're staying 6 feet away from everybody. You'll notice that Mel and I are both wearing masks. The new CDC recommendation is that everybody wear a mask in public. And there are plenty of videos on YouTube that can show you how to make a mask if you don't have one. If you do get sick with symptoms that you think are consistent with having COVID-19, please call your doctor and they will tell you what to do. Most people who have gotten it have not been seriously ill and can stay at home, drink plenty of fluids, treat the fever with Tylenol, and just stay in touch with your doctor in case you get worse. So I'm going to turn it back over to Mel.
Thank you, Paul. I agree with Paul. I think the biggest thing to reiterate to the public is, please, if you have an emergency, please go to the closest hospital or to your doctor to talk to them about what to do and to be checked out and evaluated. Please stay home, stay away from people, social distancing, wash your hands, and wear a mask. And I know Paul said that there's a YouTube that shows how to make a mask if you don't have one at home. Again, thank you for the community for all you've done for us. You've been very supportive. You've been awesome. Thank you very much.